Good afternoon, everyone. Welcome to our section today. Our topic today is bathroom safety, equipment, and incontinence, hosted by Momiji, Japanese Social Services, Yihong Center, and VHA. We will quickly go through the housekeeping rules. So this section is recorded. Please refrain from recording, taking photo of this section. You will receive a copy of the presentation slides after the section. You unmute during the presentations, and the question received via chat will be taken at the Q&A time. And it will be great to see everyone's faces. So if you're comfortable, please turn on your camera so we can feel more engaged. Hosting organizations. We have Chikage. She is a program worker from Momiji Healthcare Society. We have Rumiko from Japanese Social Services. She is the volunteer and program coordinator. And myself, my name is Fiona. I'm the program worker from Yihong Center. And we also have Leslie today. She is the house call program director from VHA. So we have two presenters today. So one is Amber Prowse-Zwegers. She is the occupational therapist from House Call. And the second presenter we have is Dr. Katrin Dolganova. She is the physician from House Calls.
Hi, everyone. I'd like to welcome you to our talk today on incontinence and bathroom safety. My name is Amber. I'm an occupational therapist on the House Calls team, doing home visits around Toronto with seniors. I'm going to be speaking to you today about some simple things you can do to make toileting and bathing safer and easier. I'm here today with one of our family doctors, Dr. Dolganova, and she's going to be speaking to you about incontinence. The House Calls team is a primary care team of family doctors doing home visits with seniors who are either homebound or at risk of becoming homebound. The team was founded by Dr. Mark Novichinsky, who was a family doctor and noticed that some of his patients couldn't get to his office, and so he started this team. You have to be over 65 and unable to access primary care due to physical, cognitive, or social challenges. And it's an interdisciplinary team with 2 coordinators, 10 family doctors, 3 nurse practitioners, 3 physical therapists, 2 social workers, 3 OTs, and we are accepting new patients. Okay, so today we're going to be talking about a case study, a lady named Mrs. Smith. We're going to talk about general home safety and fall prevention, toileting safety, and bathing safety. Okay, Mrs. Smith. Mrs. Smith is an 87-year-old with osteoarthritis affecting her hips and knees and congestive heart failure. She lives alone in a 1-bedroom apartment with minimal safety modifications in place. She doesn't use any gait aids. She's experiencing some functional incontinence and urinary frequency, especially at night. And in terms of functional incontinence, that just means that she has normal bladder control, but has trouble getting to the toilet in time because of physical challenges like her arthritis. Mrs. Smith reports joint stiffness and pain, which is affecting her balance and her ability to move safely throughout her home. She recently had a fall in her bathroom at night as she was rushing to get to the toilet in time. She's very private and she didn't tell her loved ones about her fall.
How can we help Mrs. Smith manage more safely? Urinary incontinence is not always just an issue with the bladder, but can be affected by other factors such as mobility and environment. Falls are the #1 cause of injury for seniors in Canada, resulting in 424,609 ER visits per year, and most falls, up to approximately 61%, happen while walking.
Mobility aids. Mrs. Smith could try using a rollator walker to help address her poor balance and support herself better while she's walking. She could work with an occupational therapist to help choose the proper walker that fits her and to learn how to use the device safely. Mrs. Smith could also use modified clothing, like in the pictures here. Things like a gown, Velcro pants, looser pants with an elastic waistband can make it easier when you have to go to the washroom quickly to get your clothes off. Okay. Toileting safety. Mrs. Smith could consider using a bedside commode to make it easier to toilet at night so she doesn't have to walk all the way to the bathroom. Mrs. Smith could use incontinence briefs, which are helpful in case she doesn't make it to the toilet or commode in time. She won't have to worry as much about having an accident. Timed voiding is another option where she could set a schedule throughout the day to sit on the toilet and try to urinate, which can be helpful to avoid the urge to need to urinate when one's bladder is very full. Mrs. Smith finds it difficult to get on and off her low toilet. There are a bunch of options, like you can see in the pictures here, to make these transfers easier. Things like a raised toilet seat, a toilet safety frame, installing a grab bar next to the toilet she could use to help pull herself up to standing. A commode chair over the toilet is another option, like in the picture, which works well because that would allow her to raise the height of her toilet and also give her arms to help push herself up to standing. Mrs. Smith has a shower in a tub combination. She's struggling to shower herself. She feels scared and unsteady when she tries to get in and out of the shower. She's terrified of falling. She also finds she gets very tired while showering and she has to have a nap after. So some ideas to help her, she could install wall-mounted grab bars, which are drilled into the studs in the walls. We don't recommend suction cup type grab bars because they can come off when you're holding onto them. Generally, having one at the entrance and one on the inside wall of the shower works well. If she's not allowed to install grab bars, a bathtub clamp-on rail is another option available, and it's not permanent. It's just screwed onto the side of the tub. She could try a bath seat with a back to help her to conserve energy while showering by sitting down. She could try a handheld shower head to allow her to wash herself while sitting. A non-slip bath mat is a good idea, like the one in the picture. If she has trouble bending forward, a long-handled sponge could be helpful to wash her lower body. And she could consider getting help from a home care personal support worker or PSW when showering.
Amber, what is a bathtub clamp-on rail?
Yeah, that's a great question. So there's no picture of one, but it's a rail that's sort of like a U shape, and it screws onto the side of the tub, and it's quite sturdy, and it allows you to have something to hold onto when you're stepping over the edge. Thank you so much. Now I'll turn it over to Dr. Dolganova.
Hello, my name is Dr. Dolganova. I'm a family doctor with specialization in care of the elderly. I work with the House Calls team, and today I want to talk about some common misunderstandings that people have about urinary incontinence or bladder leaks. Urinary incontinence means leaking of urine or pee, or not getting to the toilet in time. So sometimes the bladder can work fine, but the person can't reach to the bathroom in time because something got in the way on the way to the washroom, or because they have trouble walking or trouble taking off their clothing. And this can cause leaks. Many people think that bladder leaks are just part of normal aging or normal as everybody gets older. But this is not true for everyone. Yes, incontinence is more common with age, but most older adults living at home do not have it. Only 1 in 3 people who are over 65 have bladder leaks. Now, people who live in care homes or nursing homes they are more likely to have urinary incontinence. Maybe half to 3/4 of people who live in care homes have incontinence. Also, women are about 2 times more likely to have incontinence, so more than men. This is mostly because of body differences between men and women. But at the end, remember, incontinence is more common with age, but it is not a normal or inevitable part of aging. As we get older, some normal body changes can make bladder control harder. For example, we make more urine at night, so we may need to get up to go to the bathroom when we're sleeping at night. The bladder also gets less stretchy, so it can't hold as much. This means that as you get older, you may feel the urge to go to the bathroom more often, even if there isn't much pee or urine in the bladder. Sometimes the bladder doesn't empty fully, and this is why people feel like they need to sit down or go to the toilet again after they've been to the washroom just 5 or 10 minutes ago. Constipation is also more common with age, and hard stool in the bowels can press on the bladder and cause leakage. And changes in the brain and slower walking can make it harder to hold on to urine or get to the toilet in time. At the end, small changes with bladder are normal with age, but big bladder problems are not. So you should speak to your doctor if you're having big problems. Help is available. People think that having a baby can make bladder leaks happen sooner, but not all women who give birth will have incontinence. And some women who never had children can still have incontinence. So we know that other things like family history or genetics, our lifestyle and aging can cause bladder problems. Many people feel embarrassed to talk about bladder leaks, even with their doctor, but it's important to speak up and speak to your doctor. That is because incontinence can lead to poor sleep, feeling sad, less activity, and staying away from others. Getting up at night or rushing to the toilet can also cause falls. The other reason to talk to your doctor is sometimes incontinence can be caused by something simple, like a bladder infection or a medication side effect. Other times, incontinence can be a sign of a bigger health issue, like nerve issues, dementia, or pelvic problems. That's why it's always a good idea to talk to your doctor if you're having trouble with the bladder. Some people think they have bladder problems because their bladder is too small. But it's not the size that matters, it's how much the bladder can hold before you feel like you need to go to the toilet. Most people feel the urge to pee when there is a half a cup of urine in the bladder, but they can still hold it in. Older adults may not feel the need to go pee until there's more urine in the bladder, like the size of a soda can. Once the bladder fills up to the size of a water bottle, it becomes very hard to hold on to the urine. That's when leaks can happen if you don't get to the toilet in time. As we age, the bladder may not stretch or bounce back as well. And this can be affected by age, menopause, weight, constipation, medications, or health problems. In men, an enlarged prostate can affect the bladder and make it harder to empty. In women, childbirth or menopause can make the muscles around the bladder more weak and cause problems. Bladder control is not just about the bladder. Many things can make it harder to protect yourself from having bladder leaks. Getting to the bathroom can be hard if there are things in the way, like wheelchair straps, tray tables, or bed rails. If you have trouble walking, it may take too long to reach the toilet in time. You also need hand strength and coordination to undo clothes in time. And the brain plays a big role too. It takes humans years, sometimes 2 years, to learn bladder control. So problems with memory or thinking can make it harder to have bladder control. And illness and medications can cause incontinence too. Some people drink less water to avoid leaks, but when you don't drink enough, your urine gets strong and can irritate the bladder, making you feel like you need to pee more often. This is called overactive bladder. It's better to drink during the day and only cut back on fluids after supper to avoid going to the bathroom at night. Most people need 2 to 2.5 liters of fluid per day, and that includes drinks and watery foods like soup. If you have bladder problems like leaking or going too often, I recommend avoiding alcohol, caffeine, fizzy drinks, and to stop smoking because these can make bladder problems worse. How much is it normal to go pee? There's no right number. Everybody is different. It depends on how much you drink and what medicine you take, but most people pee 6 to 7 times a day, but anywhere between 4 to 10 can be normal. And remember, it's normal for people to get up once or twice at night, especially after the age of 40. There are many advertisements for pills to treat overactive bladder, but these medicines don't work so well. They only reduce leaks by about half per day and cut the bathroom trips by only 1 time a day. And whether you take a medicine is up to you, but keep in mind that these medications can cause side effects like dry mouth, constipation, or they can affect thinking. So may not be a good idea for people with dementia. Many people heard about Kegels or pelvic floor exercises. They are not just for women who had a baby. Older adults can do them too if they can learn and remember how. But Kegel exercises only work if they're done right and regularly. Many people just don't do them correctly. It's best to learn how to do them from a physiotherapist or a nurse who knows about pelvic health. There are a few bathroom habits that might help with bladder problems. They don't work for everyone, but they are safe to try. Timed voiding means going to the bathroom on a schedule, even if you don't need to go. Most people try to go every 2 hours to make this work. Double voiding means trying to fully empty your bladder by getting up after you're done and then sitting back down and trying to pee again, or sometimes pressing on your belly or moving side to side to get a little bit of extra pee out that second time. Another helpful method is called habit retraining or urge suppression. It means teaching your brain not to rush to the toilet every time you feel the urge. So when you feel the urge, you stop and stay still You squeeze your pelvic muscles like you're trying to stop your pee from coming out. And when the urge to go is the strongest, you try and distract yourself by counting, singing, looking at something, and then you wait until the feeling goes away and then calmly walk to the bathroom. This method helps you to regain bladder control. Think of it as mind over bladder. So the following are take-home messages that I hope you learned from me today. Incontinence is common but not guaranteed part of aging. Genetics probably do play a small role in this. Incontinence is not just a problem with the bladder, but you need mobility, environment, thinking, and overall health to be continent. And finally, treatment is individualized and needs to treat the underlying problem. And remember, medications are available, but they're not very effective and can have side effects. Thank you very much.